I'm Dr. Krishna Jain. I'm a vascular surgeon attending TED. Dr. Ramaya invited me here, and I'm here talking to Dr. Erickson.
I'm Curtis Erickson. I am a vascular surgeon working with Honor Health. Been here since 2004, 2005, and it's a great conference. Really enjoyed it.
Yeah, so Dr. Erickson, what do you like most about this conference? Because I know you've been heavily involved with the conference. So.
Well, I've been to a lot of meetings. Dr. Ramaya brings in nationally recognized experts, sometimes world experts, and it's kind of a low stress situation. The topics are varied and quite diverse, and the presentations are short. They keep your attention, and the topics are quite useful to our practice.
Now we have a lot of interest in limb preservation. You went in the podium, we were talking about that. So
right.
What are your thoughts? What should the vascular surgeons be doing to improve the overall limb preservation structure?
Well, I think as a vascular surgeon, I think you need to be an expert in both operative limb salvage as well as endovascular limb salvage. When I was training, it was a purely operative approach. I learned endovascular techniques later on in my career. I had the opportunity to train under Dr. Dietrich for a period of time at Arizona Heart, and that's kind of where I got my training. And the technology is just expanding exponentially. Our ability to save limbs and to improve perfusion has changed remarkably over the last 20 years with a lot of the endovascular technology that a lot of it was presented at this meeting today has allowed us to really extend our ability to improve perfusion and avoid amputation and save limbs a lot better than in the last 30 years or so.
How do you see that the role of vascular surgeons and podiatrists working together, wound care centers? Do you have some thoughts about that?
Absolutely. So, I mean, it's when I was training, we would take care of everything. We would do our own wound care. We would take care of diabetic feet wounds. We would do all that. And the problem with that is that since that training, the complexity and the technology of wound care has just exploded, and it's really. And then at the same time, the endovascular techniques have exploded. So it's very difficult for an individual to be an expert at all that. You can't keep up with all the different wound care techniques, the different prosthetic skin grafts and autologous skin grafting, and all those techniques, and then at the same time be an expert at endovascular and operative vascular surgery. It's just become too complex. Yeah. And so in order for me to keep up with what I need to do to improve perfusion, you have to have experts in wound care like podiatrists, specific wound care physicians to keep up with that part of the care of the patients.
Now you're here working with Dr. Ramaya. What would you recommend him to do next year for the conference? What would you like to see next year?
Well, I think he's done a fantastic job. Maybe something besides golf, since I don't golf.
How about tennis?
Pickleball.
Pickleball, yeah, that's the new
I think we can all play
rage,
pickleball or ping pong. But no, I think he's done a great job. I think the variety of topics is really basically covers the whole scope of vascular surgery. We even added topics on AI this year, which I thought was phenomenal. So he's kind of kept up with sort of the new technology trends. I'm sure he'll continue to add certain topics that are mainstream, like he's done this time.
Well, thank you very much, and hope to see you again next year.
I appreciate it. Nice meeting you.